So good evening, good afternoon, good morning, wherever you are from. Welcome to Edu Skills, OET Medis. Today we'll be reading subtest. One part A. So we have done nearly 24 part A segments, uploaded videos are there. So we'll not be doing in detail. However, we will take all the steps to work out how it is to be handled. Our mission is to make you fall in love with OET. If you are watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. Reading means you have part A, part B, and part C. Okay. Part A has 4 texts: text A, text B, text C, and text D. Now the instructions are this: time 15 minutes, and you'll be able to do it within 7 minutes definitely. If not 7 minutes, maximum 10 minutes. Okay. Right. Look at the 4 texts A, B, C, D in the separate text booklet. You'll be given a separate text booklet, and the question answer will be different booklet. That will be collected soon after 15 minutes. So our target is to complete it in 10 minutes, if not in 7 or 8 minutes. For each question 1 to 20, look through the text A, B, C, D to find the relevant information. Okay, write your answers on the spaces provided in the question paper. Some people do write answers in different places. So make sure you just fill in the space given for the answer. Answer all the questions within the 15-minute time limit, which means those answer sheets of part A will be collected. So after 15 minutes, you will not be able to do anything later. Your answers should be correctly spelled. Spelling mistakes will be penalized. And good number of you lose your score because you make mistakes in the spellings. You are not allowed to make even minor mistakes in the spellings. Okay. Reading part A. 4 texts: text A, text B, text C, and text D. But one theme. Okay. All the 4 texts will have one theme. 20 questions, 15 minutes time. Greatest challenge or enemy is time. Expeditious, fast reading task. What do you mean by expeditious, fast reading task? Means your speed. Smart reading is not your detailed reading. Your smart reading is text DR. You have to read very fast. Always I say the expected brand score is 450, if not 500. That's the best way to score higher. Greatest mistake, targeting grade B. This is the reason you target grade B, the psychological impact on mind and brain, you get 340, 330, 320, 310. Because your mind will be satisfied by getting 30 right, you say, okay, I am competent, I can write. Then you will never improve. And I tell you, this is the biggest hurdle people face. That's why always I tell you to target grade A or more, A or A plus. And greatest mistake is targeting grade B. Whatever you practice, however you practice, you end up with 340 or 330 or 320. Okay. Part A, nature, expeditious reading task. 20 questions, 15 minutes, almost like 45 seconds for a question. Skills assessed here. Number 1, your ability to skim and scan quickly across different texts on a given topic. Specifically, your skill to skim the text. Okay. Most of the questions will be answered by skimming the text. Ability to locate specific information from 4 short texts in a quick and efficient manner. Okay. Ability to understand the conventions of different medical text types. There are different conventions. I've already explained different conventions of how texts appear and what are the sequence, all those things. And again, we'll be explaining. And also they assess your ability to understand the presentation of numerical and textual information. Number and text together. Yes, today we will be just looking at necrotizing Fasciitis. The first step is identify 4 text headings and write down on a piece of paper. Do you have a notebook? And if you have the hard copy, take the hard copy and notebook. Or on the hard copy, if you have the hard copy, you can write on top of it. Identify the 4 text headings. So now there is text A, text B, text C, text D. Can somebody tell me what are the headings? Just write down these things. Text A, definition or description, whatever you want to ask. These are just for your convenience, for your understanding. Anything you can write, okay? Definition and classification. Text B, treatment. Text C, okay, supportive care. Text D, advice on aftercare. These are the 4 texts, one theme. So this is the one. Text A, definition and classification. Text B, Even instead of definition, if you write description also, no issue, okay, because we are not bothered about the scientific difference between definition and description, only for your understanding. You have to write this on each table, each page of your question booklet. Text and question booklet. Treatment, supportive care, advice on aftercare. Skim the 4 texts, highlight the clues. Skimming the 4 texts means you will have to do it within 20 seconds. What do you have to skim for or look for while skimming? Title of the text, section heading, subheadings. Title means, what was the NF is the title. Then each section, each text may have a heading, that is section heading. Then each text may have, for example, definition and classification. Subheadings probably will be there in some texts. Then you have to look for names. Names of what? Names of any test, any medicine, any medication, any instrument, any device, any names. Then number and percentage. Then look for sequential expressions. Look for frequency expressions. Sequential expression means first, second, third, another one. Okay, lastly. Then frequency expressions, very often, rarely, seldom. Then scale, majority, most, majority, many, some, few, all those things. Adjectives, then negative expressions. These are the things you have to look for when skimming. Skimming means just running through the text. Now, can you find out something here? Any of these things? Let's skim one text. This is what? Necrotizing fasciitis. So text A, this is what I said, 4 texts will be there. What is this? NF, the first one what I highlighted is, that is the main heading. And all the 4 texts will be dealing with this topic, this heading. Now here there is no subheading, but then you can find, if there is no heading, subheading, you can find out here. From the topic sentence, necrotizing fasciitis is means they are going to describe or define it. So there is a definition. The topic sentence gives you the idea. It's a definition. Then what else you have to identify? Have you written down this? Maybe just write down these things. These clues just write on your notes fast. Title, section headings, subheadings, names, numbers or percentage, sequential expression, frequency expression, scale, adjectives, negative expressions. So you have to identify these things while skimming the text. So since if there is no heading, you have to look for the topic sentence. You get the heading. So this is the definition. Then what else you can identify here? Whatever you have written now. Septic shock is a condition, right? The 32% I said you have to identify the 32 number or percentage. So here you have number and percentage. Yeah. Next one is, see, you don't have heading here, side heading, but then it is written classification of response pathogens according to type of infection. So classification is the subheading. So for the heading, you can create a heading as text heading, text A, definition and classification, only for your understanding. Okay. Now here you see you have to understand this classification of responsible pathogens according to type of infection. One type of infection, one type of pathogen, or 2 types of pathogens. Each type. So you have to connect that relationship. Now, microbiological pathogens, site of infection, comorbidities, type. So type 1, type 2, type 3, classification. So here, just have an idea what these are pathogens. These are site of infection, where it will be, where the infection will happen, which part of the body. Which part of the body. So as soon as a part of the body is asked in the question, answer will be in this column, right? You have to connect that part of the body with the type of infection. So you can maybe highlight here what are the pathogens. Site of infection, these are the trunk and the peripheral limbs, trunk and perineum, limbs, trunk and perineum, only 2, 3. It's all repeated, but 2, 3 body parts are given. I hope if you have taken the hard copy, you have this, right? If you have taken the print, take this page. That's why I type this page together, all the questions, for you to understand. Now, you have to highlight the hedging words which connects to one of these categories. You are supposed to mention only 1 to 7 questions, match the text, right? But then I suggest while you practice, You match the text with all the 20 questions. That's a very good practice. Then immediately you know where is the answer, in which text. You search all the texts. So these are the 4 things you should have in your mind: description, classification, treatment, supportive care, advice on aftercare. Now question 1, the drug treatment required. What is the edging word? Yeah, treatment. Immediately where you know where it is, right? So B, which parts of the body can be affected? Parts of the body. Okay, let's see. The various ways calories can be introduced. Calories. Yeah, let's see. Then who to contact to help the patient after they leave the hospital? D, right? No, this is right. After they leave the hospital, after care. So easily you can connect it, right? What kind of dressing is to use? Dressing is supportive care, C, yeah. And you are getting 10 marks each, right? So within fraction of seconds, just reading without looking at the text at all. Then how long to give drug therapy to the patient? Drug therapy. Therapy is the synonym of? Yeah, drug and therapy both are the synonym of treatment, yeah. So B. How can they give such easy questions in OET? Yeah. They are asking you to match the text. Go and read the text and match tell us where this information is given. But already things are said here. Next one. What advice to give the patient regarding needle use? Advice. D, yes. And you say this is difficult, right? Yeah, which 2 drugs? Till 7, this is what you have to do, nothing else, right? 70 marks within fraction of seconds. Just type the letter, yes. But we will do for 20. Which common metabolic condition may occur with NF? Metabolic condition. Condition, the class, where it comes? Yeah, yes. Then, what complication can a patient suffer from if NF isn't treated quickly enough? A. Then, 11th question. What procedure can you use with a wound if the patient can't be operated on? Procedure. What should the patient be told to use? Patient be told. Synonym of advice. So, D. And that's why I said you should know the sequence, the patient be told to use to clean an injection site. That is advice on aftercare, right? So, the patient be told. Which 2 drugs again? How simple and easy. Treatment. B, right? Yeah. Yeah. 14th one. What kind of infection should you use tetracyclines for? What kind of infection should you use for tetracycline treatment, right? 15. The average proportion of patients who die as a result of contracting NF is proportion, average proportion. Yeah. 16. Patients who have eaten dash may be infected with Pheromonas hydrophilia. There should be some food item, right? Mentioned, right? In the gap. Answer should be eaten something food. Yeah, some food. Yeah, then type 2. Patients with type 2 infection usually presents with, see, as soon as you see type 2, you know what is it, right? Classification, right? Classification. Again, here also you need not even read the full thing. Type 1. Okay? You need not even read the sentence question. Immediately you know where it is. Yay. You have to just go and search the type 1, type 2. 19. The patient needs to be aware of the need to keep glycated hemoglobin levels lower than dash. Yeah. You need to be aware. Patient needs to be aware means advice to patient, right? Advise him. Create awareness in him. That is aftercare. So, yes, D. Last one, 20th. The patient will need a course of dash to regain fitness levels after returning home. Aftercare, right? So this is the advantage of having the headings created first. Immediately, this is while practicing. Okay, when you do your exams, nothing is required. Once you are competent, as soon as you read, immediately you identify the things. Okay, you can simply go to that site. Now you know exactly where the answers are. Now you see questions. From a text, you have 1, 2, 3, 4, 5, 6, 7 questions. You can write down this way. Once you have written A, B, C, D there, from each text, right? You can collect those texts together. Now you have written here A, B, C, D. Right? All the A's should be together, question numbers. Copy and paste there or write down. Then B's together, C's together. That's what I have done here. Questions 2, 9, 10, 15, 16, 17, 18 are from A text. Next step could be this one. Okay. Which parts of the body can be affected? Where is it? They are asking you to connect it to the text. See? Infection levels in all these parts, right? Scrotum, perineum, abdominal wall, the extremities. So this is number 2 answer for number 2, question 2. Then 9.1, which common metabolic condition may occur with NF? Where do you have 9? So it is here with the type, right? Comorbidities type along with diabetes mellitus. This should be 9. Okay, there is a mistake. This should be 9, right? Next question 10 you have already here. 10, right? What complication can be patients suffer from if NF isn't treated quickly enough? That is mentioned here. Infection progresses rapidly and septic shock may ensue if it is not treated immediately. Hence, the mortality rate is high. Okay. The average proportion of patients who die as a result of contracting NF is average proportion. When you say proportion, it's speaking about
percentage.
Number, right? Mortality 32.2%. Then 16. Patients who have eaten dash may be infected with Aeromonas hydrophilia. So they are asking for a food item, eaten dash.
Seafood.
Yeah, seafood. Okay. Then 17 patients with type 2 infection usually present with infected dash. So immediately you have to go to type 2, right?
Yes, sir.
Type 2, limbs.
Parts of
infected limbs, parts of the body. Then last one, type 1 NF is also known as, immediately you have to go to type 1. Type 1, polymicrobial. Yes, it's given in the bracket. Also known as, bracket means also known. This means this, right? So that is it. Now we'll go to the second one. I just wanted to give you an idea about it. Yes. So these are the answers. So which part of the OA is given in the diabetes mellitus. Then complication, septic shock. Then proportion patients who die, 32.2%. Seafood may be infected, eaten seafood. Type 2, infection usually present with infected limbs. Type 1 NF is also known as polymicrobial. That's it. So let's go to text 2. Now you can continue, okay? It's your cup of tea. Now skim this text. I will highlight whatever you say.
Antibiotic treatment.
Okay, treatment, right? That is a subheading.
Yes.
Treatment is the word we used for our heading, short heading, just to understand. So the whole thing speaks about treatment of type 1, treatment of type 2, treatment of 30, treatment of type 4. So what will you highlight here immediately as you go on? Medicine
Ampicillin. Ampicillin.
Okay. There will be many because it is treatment. There will be many. You can highlight them.
Type 1, 2 first.
Yeah.
You need to underline the type 1, 2, 3 and 4 first.
Yeah. Okay. What else you want to highlight? Fast. Medicine names you will have to highlight. Antibiotics such as
Ampicillin.
All the antibiotics.
Yeah. We can highlight these things and connect it with the the type when it appears in the question. Then type 2,
MSS.
MSSA.
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 MRSA.
Next MRS.
MRSA.
Vancomycin or doctor.
Vancomycin and daptomycin.
Okay.
Lisinopril.
Always whenever there is a conjunction, possibility is there, okay?
Yes, sir.
And is here, right?
Yes,
Normally there is a possibility if there is a conjunction. Type 3.
Clindamycin and penicillin.
Yeah. Again, there is a possibility.
Conjunction.
I don't know, possibility. Because conjunctions are very sweet for OET and IELTS people. Then if
Vibrio infection.
embryo infection condition is
Tetracycline.
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 Doxycycline and minus.
This is also medicine, right?
Yes, sir.
Cephalosporin.
Since these antibiotics have shown to reduce the mortality rate, statistically. Type 4.
Amphotericin B.
Amphotericin B.
Again, there is a conjunction, right?
Yes, sir. Or is there?
Or
Possibility. All may not be the answer, but 1 or 2 of these 3 must be the answer, I believe. Okay, all need not be. But the results of this treatment are generally disappointing. And this is a technique they use, okay? But there's a contrast, right?
contrast one.
If there is a contrast, what happens? This can be treated with this, but it is not useful. So this they use, mostly they use very often in the IELTS tests, in listening tests. Now they are saying, can be treated with these 2 medicines, but the results of this treatment are generally disappointing. No results at all. Do you need to treat?
No, negative expression.
So what happens? This normally will not be the answer. Because already said these are the medicines, but that will not have any result. You will never be healed. Which means don't do it. Correct?
Yes, sir.
So immediately you can eliminate such negative expressions. That's what I said. You should be able to understand negative. Antibiotics should be administered for up to
5 days.
for up to 5. Number is there, right?
Yes, sir.
5 days.
5 days.
Number is very important, okay?
6 weeks.
And 4
Medicine
to
name and number.
4 to 6 weeks.
4 to 6 weeks.
Antibiotic therapy.
Yeah, 4 to 6 weeks. These numbers are very important. Now we have names and numbers in this 2. Now let's go to the questions. See, these are the the drug treatment required. So we said it is heading is
Treatment.
treatment. We'll just highlight once again. How long to give drug therapy? Drug therapy is treatment, right? Therapy is treatment of synonym. Now they are asking how long. Means there should be number, right? How long? How many days or something like that, right? Which 2 drugs can you use to treat? Which 2 drugs means 2 drug names will be the answer. 2 names that we highlighted will be the used to treat Clostridium. Yeah, treat this particular pathogen. Okay, so you have to link between these 2, this condition and these drugs. Which 2 drugs again? They are asking again the names of 2 drugs. How simple once you understand this. To treat what? Can be used if you can't use. Yeah, if you can't use
Vancomycin.
Yeah, if you can't use this one, which 2 means? So you have to look for this name. With that, it will be given, right?
Yes, sir.
Yeah. What kind of infection should you use? Tetracycline medicine for which infection? They are asking what kind of infection, which type of infection. Which type of infection? You have to simply connect it. So where do you have the answers? First one, the drug treatment required. Already you know, it's in B, right?
Yes, sir.
Yes.
The drug treatment is the C, concept of B. How long to give drug therapy to the patient? It is in B, only to connect. How long to give drug therapy? It is given at the last lines, right?
4 to 6 weeks.
Oh, see, I said 5 days, 4 to 6 weeks. Numbers are important. That is next question. And next question, which 2 drugs can you use to treat Clostridium species of pathogen? Clostridium. Where is Clostridium?
Type 3 for the clindamycin and penicillin.
Clostridium. We did not highlight this. This we should have highlighted, right? Okay. So the answer is?
Clindamycin.
Yeah, I said when there is a conjunction, that must be the answer, right? And that is right. So again, 13. Which 2 drugs can be used if you can't use vancomycin? So look for vancomycin. There is vancomycin. See vancomycin. We have highlighted here.
Daptomycin and linezolid.
Again, I said if there is a conjunction, that should be the answer, right?
Yes.
See, so many medicine names are given, but wherever there is conjunction, that is the right answer. But here there was or another conjunction, but that was negative expression, so we eliminated it. How beautiful. Next, 14th one. What kind of infection should you use tetracyclines for? Tetracyclines. You have to look for tetracyclines. What kind of infection?
Vibrio infection.
Yeah, tetracyclines we have already highlighted. So what type?
Vibrio infection.
Vibrio infection.
Vibrio infection.
So what should be the answer? Vibrio or infection?
Vibrio. Vibrio.
Yeah.
Vibrio
You can write Vibrio or Vibrio infection. Both will be right, but if you write only infection, that will be wrong. You can write Vibrio or Vibrio infection. Both are right because this is not filling the gap.
So the short answer.
This is short answer. It's not filling the what kind of infection they're asking. So you can say Vibrio infection. But if they are asking dash infection, should you use tetracycline for? Then you cannot write Vibrio infection. You have to write only Vibrio. Because otherwise they'll be doubling. You will lose the mark. Did you understand? There are some doubts repeatedly asked. Should we write Vibrio infection or Vibrio? Now, don't confuse. If it is a fill in the blanks, if you write Vibrio infection, that will be wrong. Because dash infection, after dash infection is already given in the question, then you cannot write infection in the answer. Only Vibrio you have to write. Do you get me?
Yes, Father.
Yes, Father.
That is so beautiful, right? Name and numbers. So the answers are here. B, then intramycin and penicillin. Vibrio infection. And even if you don't write and, that is right, okay. Even if you put a comma there or if you write 2 words there without and, that will be right because which 2 drugs they are asking. Just write 2 drugs name or you can write with and, conjunction. But the clue is there, whenever there is a conjunction, mostly that has maximum chance of being the right answer. Shall I give you one more task?
Sure.
Yeah. Now skim this. What has to be highlighted?
Supportive care.
Supportive care. That's what we have taken as the heading, right? Since there was no heading.
Wound care. Second paragraph.
Wound care. Okay. What else?
Here it's mentioned nasogastric tube pectoral. This can be delivered orally via nasogastric tube.
Okay.
24 hours.
So
24 hours.
24 hours.
Hospitalization.
Okay.
Adequate nutritional support. Second line.
Okay.
Next, albumin. These are the names we need to highlight.
Monitoring of albumin.
Albumin, the names,
Pre-albumin.
pre-albumin, just only the names you need to write.
Baseline repeat monitoring.
Triglycerides.
Okay.
One more thing, we need increased caloric intake. Require increase the third line. Required increased caloric intake. Bone care. Vacuum assisted closure. VAC.
VAC.
Wet to dry dressing. First line. The topic sentence. Wet to dry dressing.
Second line.
Second line, advanced wound dressing have replaced wet to dry dressing. Grafting. Fourth line, grafting.
Skin graft.
Okay. Let's go to the questions. Did you find C had very little strategies compared to A and B?
Yes, Father.
So you'll have very few questions. Only 3 questions, I believe. And you see, the various ways calories can be introduced, that is in C. What kind of dressing to use, that is in C. What procedure can you use with a wound? Because 3 and 5, we have simply answered it, right? Just reading it.
Yes,
We don't require because synonymous expressions were there. Now we are bothered about only about 11. What procedure can you use with a wound if the patient can't be operated on? That's all you have to see from. That's why you don't see so many strategies here or clues here. If you cannot be operated on, what procedure has to be used?
Vacuum assisted closure. Vacuum assisted closure.
Where is it mentioned? The question says when a patient cannot be operated upon.
Cardiac status was too precarious to undergo a long surgical.
Okay, under long surgical. Okay, correct. Yeah, too precarious to undergo a surgical operation. Okay, correct. Exactly, you're right. So it is VAC, and you know there is a name that definitely is the answer. Abbreviation, right?
Yes, sir.
Yeah. That's the only name you have here. So that is the answer. How simple. Once you know there are only 3 questions from this and 2 are answered, you need not spend too much time on that. Maybe you can leave it for the last minute. You can skip such questions. So that's why I said when you see there's no many answers. So immediately you can go A, B, D, then come to C. Did you understand?
Yes, Father.
Okay. Now text
Yes,
D.
Father.
Tell me what is to be highlighted.
Advice.
Advice and aftercare
Advice to
was
give
the
patient.
heading given. Okay. Advice to give the patient before discharge.
Then remind.
Okay.
Remind.
Okay.
The wedding.
Yeah. Before discharge means after care. Patient while discharging means after care.
Yes.
Anything you can write, whatever for your understanding. Okay. Now just skim it. After care is given here in the beginning itself.
Home health care and
Management.
instruction regarding board management, social services to
Tell me what I have to highlight.
Management.
Wound management. Okay.
board management, lifestyle changes and
Lifestyle changes and
Financial concerns.
Okay. Fast.
Physical therapy.
Physical therapy.
Optimal physical
optimal
health.
physical health,
Physical health.
Life-threatening
Life-threatening nature.
nature.
nature of NF,
Limb amputation.
scaring,
Limb amputation.
Limb amputation.
Caring limb amputation.
Remind the diabetic patient to.
Then next, last
You
HbA1c.
have percent.
HbA1c
HbA1c.
7%,
HbA1c you have. So if there is number name, that will be the answer. Then
Not to reuse.
needle capped,
Needle caps.
needle capped
Reuse
until
the needles.
use,
Do not.
sorry. That's
not
there is
reuse
some
needles,
mistake. Needles capped until use and not to reuse needles.
clean the skin thoroughly,
Glucose testing or insulin
Glucose.
injection.
Glucose
clean the
testing.
skin
Testing or
thoroughly,
insulin injection.
Alcohol pad.
Alcohol pad.
Alcohol pad.
Use alcohol pads. Okay. Question is here. Okay. So these are the questions. Who to contact to help the patient after they leave hospital. After they leave hospital, we said that is aftercare. Who to contact to help the patient. That is just to mention the
D.
D letter. Nothing special. 7 also. What advice? That is we already seen D.
Regarding.
So we do not worry. We have to worry from here. What should the patient be told to use to clean an injection site? Clean an injection site. What to be used?
Alcohol pads.
Alcohol pads.
Where is it? Did we highlight? Yeah.
Last
And use alcohol pads to clean the
Alcohol pads too.
area afterwards.
Yeah,
Yeah.
Afterwards.
Alcohol pads. Okay. 19th one. The patient needs to be aware of the need to keep glycated hemoglobin levels lower than. Lower than means number. Hemoglobin number. You have to look for number.
7%,
7%.
And you know from your knowledge as well, right? Hemoglobin HbA1c or less, lower than 7% or less. Answer is here, 7%, right? 7% is the answer. Okay. So beautiful. Then last question. The patient will need a course of dash to regain fitness levels after returning home. Course of some medication, right?
Physical therapy.
Physical therapy to rebuild. Yeah, it is given here.
physical
To rebuild.
therapy to help rebuild strength.
Yeah.
Yes.
To rebuild, you see, to help rebuild strength. So that is clear. As simple and direct. In reading part A, you don't have any indirect answers, right? They're asking you to copy the answer, giving you the text and copy. Even the primary school students have to do it, right? They're telling you this is the text, ma. This is the question. You copy from this text and write here. Correct? That's what you do for the exam if you are given the chance to keep your notes and write the answers. How simple they are. And if you say this is difficult, what should I say? How do you say this is difficult?
Thank you, Father. Thank you so much, Father.
No, I just wanted to know. How do you say this is difficult?
Today I didn't say difficult, Father.
No, did you find any answer which was confusing?
No, Father.
No,
Direct
Father.
answers, right?
No.
Direct answers.
Thank you so much, Father. Thank you.